Hi, hello. My name is Robert Stack. I would like to talk today about opioid dependency. When I first started working in this field about almost 30 years ago, I worked at a place called Centerville, and it was a halfway house of detox. And almost all of it was straight alcohol. From there, I went to work at the Brattleboro Retreat, working in their alcohol rehabilitation unit, and then transferred over to their dual disorder unit. And occasionally we would have an opiate user in, but primarily it was professionals, pharmacists, doctors, nurses. Occasionally there would be a street person on opiates, but not often. There was not much heroin at all. As some of you are aware, that's really changed now. What we find now, on any given day, we may have 10 admissions, and up to 6 of them on our unit will be opiate addicts. What I'd like to focus primarily on is, first I'm going to review the symptoms of dependency. When does it go from just a use or misuse or abuse even? When does one cross the line over into dependency? And also at the end, I'd like to just review some of the current treatments for opiate dependency. As always, I hope this is helpful to someone. So first of all, when you think about crossing that line from use or abuse, you want to think about the 2 physical symptoms that you sometimes hear. And the first one would be tolerance. And tolerance is an indication that if you use the same amount of the drug, you get less effect, or you have to use more of the drug to get the same effect. Now, I know that sounds sort of double talk, but basically one develops tolerance to the drug. And the interesting thing with opiates is it seems as if opiate tolerance is very rapid. In other words, you could be on a steady dose of opiates, either legal or illegal, and then go up on it for a few days or a week, and all of a sudden that becomes your maintenance dose. At least that's how I've learned about it. The second thing that you'll look for is withdrawal, and that is when someone stops taking the opiates, they experience withdrawal symptoms. Now, a lot of people who are experimenting with opiates, recreational if you will, but even folks who get involved with opiates through pain management, when they first start experiencing withdrawal, they won't even know that it's withdrawal. I mean, they just feel uneasy, they'll think they have a cold, they think they have a flu. Any number of people have told me over the years that they were in withdrawal and they didn't realize it until someone told them, another user perhaps, informed them, just take a pill, just take some opiates and you'll feel better. And quite frankly, in some ways, that is actually the beginning of your addiction. When you're taking a pill to deal with your withdrawal, it's kind of like an alcoholic who's taking a drink in the morning to help with his withdrawal syndrome. So those are the first 2 physical symptoms. Is again, tolerance, needing more and more to get the same effect, and also suffering withdrawal when you stop it. The next thing that you'll notice sometimes is that people will begin to be unable to predict how much they're going to use. In other words, they're pretty sure that they're going to use X amount, but invariably they use more than they intended. So it looks like that once they begin to use, they lose sort of control over how much they use. And then they'll quickly go into the next stage, and the next stage is when they begin to try and negotiate their use. They begin to make attempts to cut down, or they'll stop altogether and they'll try and go through a withdrawal by themselves, and they'll go back to using, or they'll even be successful in withdrawal and just get through it. And again, what's happening is they're recognizing that, you know, the relationship with the drug is really changing, that it's not just recreational, it's not just having a good time, it's starting to have some negative effects, it's starting to look like, you know, and people who are concerned about it will begin to cut back, they will begin to try and stop. And I think at that point it becomes sort of worrisome. I mean, you'll literally see people begin to try and negotiate with the drug, try and, you know, go on drug holidays, or think about when they can use safely or how much they can use safely, or even switching drugs, or thinking that maybe this method of taking the drug is safer than this other method. So actually the drug becomes sort of part of their life, if you will. The other thing that you'll see is that they begin to spend more and more time on the drug, getting the drug, procuring the drug, engaging activities to get the drug, sometimes illegal activities, visiting doctors, visiting emergency rooms, and procurement of the drug becomes very important. Now, this is usually after people have experienced withdrawal, and withdrawal becomes something that they are really trying to avoid. And so getting the drug and lining up the next drug or the next prescription, it becomes something that you think about. And again, you know, once you get into the more severe forms of opiate dependency, it becomes your whole day. I mean, from the moment you wake up, the rest of the day, you are almost preoccupied with making sure you have enough, not only for today, but even maybe having some for tomorrow. Some drug addicts will sometimes refer to the wake up, have something in the morning just so you can get up and not be sick and go out and get some more. So spending more and more time in pursuit of the drug or trying to find the drug, more effort, is another clear mark that it's starting to change. And now the focus has become doing the drug. And I think this is where some people begin to get the idea that in the beginning, voluntarily, they used the drug for their benefit. But now it's starting to look like the drug is using them, and that they're actually taking the drug so that they don't get sick from not taking the drug. And in order to function in their life, they have to have the drug. And so people can actually convince themselves that in order to go to work to get the money to do the drugs, they have to take the drugs in order to go to work. Or you'll find people saying, I just have to get through the day. This is the only thing that will help me. The other thing that you'll notice at this time is that they begin to lose other roles in their lives and other activities, social things. They begin to cut back. Taking the drugs, doing the drugs becomes more and more, almost by self-definition, who they are. They don't go out, they don't do recreational activities, they don't do social activities. Their relationships with family, with friends, with others, everything begins to be curtailed. Now, this isn't true in every case. Some people who have sort of, let's say, prescribed or have better access to drugs, they may not fall completely into this, but what they'll notice over time is that they're not interested in doing other things. They're really interested in making sure they have opiates on board, and that's the way they spend the day. And quite frankly, when you have a lot of opiates on board, you don't need to do a lot of other things. You know, you're in your other place that you can sit, and you can sit in the most miserable place. If you have opiates on board, you're sort of almost fine. Remember, this is a drug that they give you when they're going to operate on you, that they're going to open up your chest and rip your bones apart and take your heart out. They put you under something that you don't feel the pain. You're not even present. They put anesthesiologists to sort of keep track of how much sedation you're receiving. And yet you'll see a lot of people, a lot of drug addicts who get so preoccupied with the drug that they'll get to a point where that they're not feeling anything. As long as they're not in withdrawal, this is the state that they want. So this becomes almost by definition, people will begin to realize, and this is when some people who are addicted will begin to call themselves names like junkie and things like that, because what they're trying to describe is almost a lifestyle. This is not about the drug. This is almost about a lifestyle that's preoccupied with the procurement of the drug, doing the drug, perhaps selling the drug to buy more to get the other drug. I mean, it's really become a lifestyle. And I think the last thing that you sort of look for when you're looking for dependency is, do you continue to use even after you have negative consequences? Like things start to go wrong for you physically, things start to go wrong socially, psychologically. A lot of folks who do alcohol, do other drugs, when it gets to a point where it's no longer fun, where it's no longer beneficial, where it seems to be costing them more than they wish to pay for the use of it, they'll stop. You'll see people who have done lots of cocaine. One day they wake up and they go, I don't know, this is a lot of money, I'm not going to do this anymore. And they just stop. People will smoke a lot of pot and stuff, and they'll get paranoid a couple of times and they'll quit. And you couldn't get them to smoke pot. you don't see this with opiates sometimes. I mean, there are occasionally some people who will stop opiates, just in time and walk away from it and say, boy, I had that brush with it and I'll never go back, I'll never do it again. A lot of folks that I see, obviously I'm in the hospital, at this point they find that they're unable to stop, even though there's been negative consequences, even though there's been things that have been happening to them. So I think you can sometimes appreciate that, when you hear, we don't use the term, but they'll sometimes use the term addict, that somebody's an addict, that suffers from addiction. And I think it's very, the root of the word addict comes from the Latin, and it used to be addictum, which was a sentence of, in assault mines, if you will. It's a form of punishment. And I think when they were looking for a word to describe opiate dependency, I mean, addiction and an addict, is very clear that you have become enslaved, if you will, by the drug. And you're no longer doing the drug, but the drug is doing you. And so this is often when I get to meet with people. And by the way, a lot of folks will try to negotiate their opiate use to hold on to their job, to hold on to their family, to hold on to things that are important to them. And it's always a negotiation. But for people who are addicted, that part of their brain that says, I want just a little more, I just need this drug today, or I'll quit tomorrow, that part of your brain becomes so powerful. If you can think about a drug that makes you feel, anything that takes away pain and makes you feel good tends to be addictive. Opiates do both, and they do it really well. Opiates will take away most incredible pain. It can also make you feel really good. I remember I was up in Dartmouth. I was going to have an operation on my eye. And I remember thinking, boy, this blanket is so warm and cuddly. And I thought the nurse who was giving me the drug before the operation, that she was awfully friendly. And I remember sitting there smiling, and then realized that it was the opiates, that I was sitting there and I was full of opiates feeling good. So it becomes, if you can imagine, if you had some sense that there was something wrong with you or something not right about yourself, and you were living in pain, self-anguish, if you will, to take the opiates, not only to take away the pain of being yourself, but also to give you this wonderful sense of euphoria, this wonderful sense of feeling good, this wonderful sense of warmness, if you will. I have to tell you, quite frankly, it becomes almost irresistible. So we have a really hard time, and I think really well-meaning people, very smart people, people who are successful in other areas of their lives, people who are of high moral fiber, people, they're sort of amazed that when they get in the struggle with opiates wins. They're just not accustomed to it. When you think about surgeons or pharmacists or nurses or it's not just street addicts. They once did a study in New York City. They wanted to see if methadone had any effect on their neurological learning and stuff, and they did IQ tests as a control, if you will. And one of the things they found was that the majority of the people who came in to be tested for methadone, for treatment, were above average IQ. And over the years, I've known very successful, highly educated folks who have become opiate addicts. And it's not a matter of character. It's not a matter of willpower. It's not a matter of intelligence. I can't tell you why some people are more at risk. We think sometimes it might be genetic. Can't really prove it, but there are some research that seems to indicate that. All I can tell you is that it is such a powerful drug that it becomes a very powerful addiction. Now, normally, when I first started working at the retreat, we would, one of the things that we would recommend is that somebody would go away for a long-term residential treatment, the Synanon model. It could be up to 6 months to a year, real restructuring of your life. And that is successful. The problem is that a lot of people just, they just didn't make it. They would leave. And the ones who stayed and saw the program through, they were very successful. But a lot of them sort of just couldn't take it and they left. And often they would go back to using. So the relapse rate after treatment for opiate addiction is fairly high. Nowadays, in Vermont, we have some other choices. We have Suboxone, which is buprenorphine, and it has something in it that's supposedly a blocker. We also offer methadone. Methadone has been around for a long time. It was developed during World War II by Germany when they lost access to the poppy fields in Turkey. It was for their soldiers to deal with their pain. When they sort of developed methadone for treatment was during Nixon's war on crime, which was one of the problems, was that it was never really done for the benefit of the addict. It was done for the benefit of society. And the idea was that we had some Vietnam veterans coming back who had been exposed to opiates, and there was some concern about that. But more than anything, it was more about property crime in the inner cities, that this would greatly reduce the petty crime, property crime. I think in some ways methadone is a wonderful drug. It really does seem to help folks. It has a bad name in the recovering community. It has a very long half-life. It has a very difficult withdrawal. And nowadays, there's certain criteria before they refer you for methadone maintenance. But a lot of times, once you're on methadone, it's probably good to stay on it. I mean, depending. I mean, if you have a good quality of life and you feel good and you go to work, you have a home, you're not breaking the law, you're in good health, I would be really careful before I'd come off it. I would talk it over with a doctor, psychiatrist, or somebody in the field of addiction, and be sure that this is the right thing. Because even after many successful years on methadone maintenance, there was a recent study done at the VA hospital in Boston with very good candidates. When they took them off the methadone, a number of them relapsed. So nowadays, mostly, if you're on methadone and you're successful and you're doing well, you can work with the clinic, you can reduce your dosage over time, just be really mindful. Like I said, we also use Suboxone. Suboxone's an opiate, and one of the things it does is it takes away the craving, if you will, and it also prevents the sickness of withdrawal. And for many addicts, those are the two worst parts of early recovery, is that they're terrified of being sick, and rightfully so. It's a horrible withdrawal. But also this incessant thinking about it all the time, 24/7 thinking about it, trying not to think about it. So Suboxone can be very helpful with that. Granted, it's just a pill. It doesn't really change your life per se, but it does relieve some of the worst parts of opiate addiction. Again, some people have a negative attitude about methadone and Suboxone. They see it as opiate substitution. And I suppose if that's all it is, if you just see it as, well, I'll stop doing the street opiate and you give me an opiate and I'll do that, I guess you can make an argument that that's what it is. I know the doctor I work with, Dr. Kane, he runs our Suboxone program. He likes to talk about Suboxone as a medication that will provide you a platform upon which you can stand and work on your recovery to get better. And so if you can think about methadone or Suboxone as medication for opiate addiction and realize that it's sort of, you still have to do your recovery. In other words, what that pills are going to do, it's going to take away some of the symptoms of your addiction, but it also should give you an opportunity to increase the quality of your life, to actually get better, if you will. And so, again, if you hear somebody talk about opiate substitution, they probably don't think that highly of it. But if you hear somebody talk about it as a medication, they're probably recognizing that some of the research seems to indicate that prolonged opiate use actually affects your brain and changes some basic operations. And for you to get clean and sober in the beginning, will be very difficult, and probably if you could be on a maintenance drug, at least for a little while you make the transition from a using lifestyle to a more healthy lifestyle, engage with 12-step programs, go to counseling, really begin to change your life and associations. Sometimes we've had very successful people, I should say we've had people who become very successful in getting on Suboxone and then titrating down, going down to lower and lower doses, engaging in 12-step programs with both AA and NA, maybe going to counseling, changing their friends, their social life, develop a spiritual life, and they seem to be successful. I think that if there's a purpose in this tape, it would be to educate both family, but also if there's any addicts who are listening. One of the things that gets kind of creepy, a little bit scary, if you're an opiate addict, is you start to get a little bit concerned that this is all you're ever going to do. I mean, in the beginning, you sort of love opiates. You think it's a gift from God. You think it's the most wonderful thing in the world. It should be free. You're going to move to Amsterdam. But after a while, you become to realize that this is the worst thing that you've ever done. It's taken over your life. It's destroyed. It threatens your family. It threatens your loved ones. It threatens your freedom. And even though you want to stop and try to stop, you can't. And believe me, that's a very sad place to be. You do things you don't want to do. You commit acts you don't want to commit. You hurt your family. You hurt the people that love you. I would like you to know that there is help. There is people that can help you. There are agencies that can help you. The most important thing is to reach out and get help. Now, there are also some people who come into opiate dependency through pain medication. They have legitimate pain. For whatever reason, they were at risk for addiction. They got involved with it, and they now find themselves in over their head. Again, the thought of living your life without opiates can be pretty scary if you have issues with pain. I mean, you just can't imagine it. But at the same time, you may have found out that you have lost control over the intake of your medicine. Again, I would reach out. I would talk to somebody. I would tell somebody. I would reach out to some of the agencies in town, some of the doctors in town, your primary care provider, and be honest with them. Talk about it. If you find yourself running out because you're taking too much before the prescription, if you find yourself considering doctor shopping, going to different doctors or going to emergency rooms or trying to get somebody else's medicine, you're probably in over your head. So please get help. Opiate addiction does not have to be life-defining. I mean, it can be something that happened to you. It can be something that you experienced. It is something that you can get better from. Probably it's more than you can do by yourself. So I would encourage, if you know somebody with opiate addiction or somebody who's dependent upon opiates, I would tell you to encourage them to go ask for help. Call somebody. They're not in this alone. Just like they use other people to get their drugs, they can use other people to get better. And I think once you can experience that quality of life and know that you can live without opiates, then at that point, you get hope. Even if you relapse, you know that you can do it, and you never feel trapped away. Some people who are in the throes of active opiate dependency, they actually feel trapped. They can't see their way out of it because it's so overwhelming and so powerful. So again, I hope this is a positive message and helpful. Thank you very much.